Hi, my name is Katie Brigham. I'm a member of the Division of Adolescent and Young Adult Medicine within the Department of Pediatrics here at MGH, and I'm here with Dr. Jonathan Slutzman, doctor in the emergency room here at MGH, and we're here to talk about some of the local efforts happening here at MGH in order to sort of enhance sustainability. Let's maybe start with talking about sort of what is the scope of the problem and why do we care?
Yeah, thanks, Katie. It's a really big problem. Healthcare is responsible for huge amounts of environmental pollution and contributions to climate change. About 10% of all greenhouse gases emitted in the United States are from healthcare facilities.
That's astonishing.
It is. Worldwide, it's more like 4 to 5% of all global greenhouse gas emissions. If the U.S. healthcare system were its own country, it would be the 13th largest emitter of greenhouse gases in the world, more than the entire United Kingdom. So we are intensive. We do a lot of great things for our patients and for our communities, but it comes with a cost. And unfortunately, that cost gets borne by some of the most vulnerable. So it's a really big challenge to try and balance doing really great work in our institution and providing excellent care while doing it in a way that can be as beneficial or at least least detrimental to the natural environment as we can be.
And clearly this is a problem that affects everyone in the world in many different ways. How are ways that you've seen this affect patients' health?
It's really a challenge in that we know that environmental pollution contributes to respiratory illness. We know that heat waves contribute to obviously heat stroke and environmental illness. It also contributes to kidney disease. There's evidence that it contributes to cardiovascular disease, cerebrovascular disease, strokes. We see spikes in all of these associated with heat waves. We also know that people who live closer to parts of our urban areas that have greater environmental air pollution, particularly near highways, near airports, near other industrial facilities, have higher rates of asthma and other respiratory illness. And unfortunately, these are predominantly the more vulnerable parts of society. People who are perhaps lower socioeconomic status have less access sometimes to the care that they need, and they're the ones who are suffering. These are really big problems that healthcare isn't the only industry, obviously, that's responsible for these challenges, but I think that we have a moral imperative to really do as good a job as we can to protect on both ends. Our job is to take care of people when they're sick and also try and prevent these illnesses from occurring in the first place.
Definitely. And what are some of the things that are going on here at MGH to try to address this?
Great. We are doing some great things. I think that first we should recognize that Mass General and Partners Healthcare as a whole have been on the leading edge to a great degree in the realm of environmental sustainability for well over 20 years. That said, there's always room to improve. And in the last year, we have established an executive level sustainability committee that's chaired by our CFO here at MGH, Sally Mason-Bamer, and we are diligently and actively working with subcommittees in all arenas of our hospital's operations to identify some ways that we can both short-term and longer-term improve our operations.
Are there any examples that you feel like have been recent successes?
We have a number of things. So if anybody's been to the cafeteria recently, you might have seen that we have some new water dispensers, some water bottle filling stations to try and reduce our reliance on single-use plastic bottles of water. We're talking about a bunch of other things. There are some things that we've been doing in the OR with repackaging and trying to reduce blue wrap use. That's been in place for quite some time, and switching to more rigid containers. We've certainly done a lot of things in the realm of energy purchasing. Virtually 100% of the electricity here at MGH comes from renewable sources, which is really quite an accomplishment that's been in place for years and continues to grow. We do get most of our heating from a cogeneration plant across the river, so we're getting essentially kind of waste steam from that plant that otherwise would be dumped, and instead we're using it to heat our facility with decreased environmental impact. There are still obviously ways that we can improve, and lots of people who are working on that. The new building that we all know about coming down the road on Cambridge Street is planned to be even more environmentally friendly than prior buildings here on campus. But we're hoping to really delve down into all of the clinical operations and ancillary operations here at the hospital to make improvements.
That's great. And what can people do to join in, to help, if they have great ideas?
Fantastic. We would love people to kind of get involved. We have an Apollo site now where people can submit suggestions, and you'll be able to see the link there so that you can, if you as a frontline worker have some idea or question about something that we can be doing better, we certainly want to hear about it so that we can investigate it and find out if we really can do it better. We have educational opportunities. Coming up at the end of March, there's going to be a pediatric grand rounds by one of our colleagues, Dr. Elizabeth Pinsky of Child and Adolescent Psychiatry, is going to be talking about climate change and health impacts. On April 1st, in the morning, we're going to be hosting here at MGH in the O'Keefe Auditorium a symposium on climate change and health and how people can really be activated and get involved. And certainly, if people have other questions or ideas, they should get in touch with us.
Yeah, great. Anything else that you want to add?
Nothing really.
Okay.
It's been great talking with you,
Awesome.
Katie.
Great talking with you too.
And we look forward to hearing from everybody at MGH.